surgical. Or there's ever heard of a pessary? A pessary is a plastic ring that can be put up in here, pushes the bladder up, pushes the uterus up, and then they put this plastic ring that kind of expands like that and holds all the other structures up above it. It can be taken out and washed and put back in again. So, Kegel exercises, pessary, or surgery are what can be used to treat this. Okay. Kegel exercises also can help to make the vaginal wall structure smaller. So, anybody ever seen something that looks like this? Sorry guys to leave you out of the conversation, but anybody ever seen something that looks like that? Not that big, but they usually come smaller. Oh, great. What? Nothing. Want to step out for a couple seconds? So this is placed in the vagina and is used, Kegel exercises can tighten up the vagina so that you can, it starts out with this large ball, and that may be, you might only be able to tighten the vagina enough to hold on to that size. And as the muscles get stronger, you can get to smaller and smaller diameters. When you do the Kegel exercise, you can't pull that structure, that piece of equipment out. So it just shows you the different, while you're trying to contract the Kegel exercise and pull on that structure. It's in the, my office, in the, yes, in the plant tray. There's a Christmas decoration. Yes, we be organized. Okay, so let's look at the gluteus muscles and then we'll stop. Okay. So this is a posterior view of the hip. Gluteus maximus has been cut. And so this would be the view with the gluteus maximus in place. And the gluteus maximus cut. Because these muscles are deep, we're going to look at this view first. Okay? So this is what we're looking at.
That's all I give today.
Sorry,
Okay,
bye, Cora.
No, thanks.
She had it open earlier. It looked bigger than $8 a drop.
I'm going. I don't care. I thought you meant a body. I'm like, how do you tell your body?
I know. Steph and I were talking about
And keep using stuff to class.
Yeah.
Why? Why?
Stop touching it.
It was crooked.
Oh my god, that made
It was crooked.
That
That
much
would have
better.
bugged me if I was watching it. It was like at an angle and you're like,
I watched. Have
I
you
said
watched?
if I was watching it.
Let's still be honest. Okay.
Who knows the Kegel?
2 in the morning, do you know
Who
how it
knows?
looks? We'll start drinking too and see how it
On
looks.
there, it's on somewhere on there.
We're drinking at
All
lunch.
right, so
Yes.
Oh no, I can't. I gotta go to work.
this
So do I.
is
All good. Drink the day away.
this is similar. We use the term homologous to the posterior surface of the scapula. So what would you say would be the 2 major functions of muscles on the posterior surface of the scapula, or maybe 3?
To erect the leg. Or
So what do these muscles on the posterior surface of the scapula do?
Oh, I thought you were talking about the back.
We were going to, but I said they were similar in function to.
Lateral and medial rotation.
What are they going to do? Which laterally?
I just said.
And what else?
Extension of the
Extension. Okay.
Lateral rotation.
So lateral rotation of the humerus, extension, and abduction. Abduction. All right. So we're going to see similar. Here's the head of the femur. And remember, our greater trochanter and lesser trochanter were more prominent structures on the posterior surface. We had our intertrochanteric crest. So, what was the rough area down the posterior aspect of the femur? Anybody remember? We had deltoid tuberosity down the lateral aspect of the humerus. Down the posterior aspect of the femur, we have the gluteal tuberosity. All right. So we'll see that when we cover it up with the gluteus maximus. But let's look first at gluteus medius and minimus. We're going to have to look at those. We're going about 4 muscles, 4 or 5. So here's gluteus minimus and medius, exactly the same function. Gluteus minimus comes off of this region of the pelvis, down here. Gluteus medius from the crest, and it covers over minimus. But they both have the same attachment, all right? So, gluteus medius, this actually should be a little bit higher, and then that's gluteus minimus. Gluteus medius does the same thing, it just starts a little higher. All right, so both of those, all those red lines represent gluteus medius and minimus. Function is abduction and medial rotation. Okay? Now, when we talk about rotation of the femur, it's a little tricky because the knee flexes and extends at a different position than the elbow does. So if I am going to laterally rotate my humerus, look what happens to my hand. It goes out laterally. If I medially rotate my humerus, my hand comes in medial. Now look at my foot. If I laterally rotate my femur, notice what happens to my foot? It comes in medial. And if I medially rotate my femur, my foot goes out lateral because my knee is bent backwards from my elbow. All right? So, lateral rotation of the femur, medial rotation of the femur. Notice which way my thigh is rotating. Outward, lateral, medial. Okay, so if I'm going to sit cross-legged, I'm doing lateral rotation. The next muscle is one of our primary lateral rotators. We have 2. This comes off of the sacrum. Its fibers are almost horizontal. It's a triangular muscle. The sciatic nerve comes through the sciatic notch, just inferior to that. And this is the piriformis. Someone who tears their piriformis can cause pressure on the sciatic nerve. So here's the edge of the piriformis, here's the sciatic nerve coming out. And on the model here, here's piriformis, and here's the sciatic nerve coming out from under its inferior border. So that can help you identify. Does that in about 85% of the cases. Sometimes it actually comes through the muscle, sometimes it comes above. But most of the time, sciatic nerve is going to come out just inferior to piriformis. Okay, we used to do the twins, superior and inferior gemelli. Much to Jeff's consternation, I stopped doing those, as well as quadratus femoris. So the only other one here is obturator internus. It's actually quite fat. It comes off the obturator foramen, passes through the lesser sciatic notch to attach to the greater trochanter. So back to our pelvis here. Here's the obturator foramen. So it's going to come from the obturator foramen like this and come around and attach to the femur. So it comes through the back. So what we see of it is very skinny. In actuality, it's a little bit bigger than that. So, wrong color. We're going to take its tendons from here. And it's going to come around. It's a relatively skinny muscle and attach there. So it is also a lateral rotator. Obturator internus. So piriformis and obturator internus are the two major lateral rotators. They'll do a little bit of extension, but because of the angle of their fibers, they're primarily lateral rotators. The last muscle I'm going to do, and I really should have my iliac crest kind of coming over here, is called tensor fascia latae. You didn't know you were carrying around a coffee muscle. This one comes off the superior iliac spine and attaches to the fascia latae, which is also known as the IT band. Probably heard of the IT band. So here is tensor fascia latae, and I'll show it to you on the lower limb model, and we'll stop there. Okay, so here is the lower limb model. Here would be gluteus maximus has been cut. This is gluteus medius. Minimus would be underneath it. Then we have piriformis. Skip one, and that skinny little one right there is obturator internus. However, here's obturator internus as well. And it kind of passes around like that. So this big muscle right here is obturator internus. And then here is tensor fascia latae. This little muscle right here coming off the anterior superior iliac spine, and this is the IT band or the iliotibial or fascia latae. So it tenses that band. Okay? So it's this tiny little muscle right here. Does abduction. Okay? So if you want to really feel that muscle burn, lie on your side and do leg lifts without ever letting your leg rest. Come down, go like this, go out like that again, come up. Do that about 15 minutes, over and over, and it'll start to burn right there. Okay? That's tensor fascia latae. So medial rotation and abduction. All right. Now, I did not do iliopsoas, so I will cut that off. But that's what your quiz will be over on Tuesday. Okay? So head, chest, with intercostals and diaphragm we didn't do, abdomen, pelvic floor, and gluteal region. Not as many as you had for today.
Have I ever told you about my term learning by fire hose?
No.
It's like trying to drink from one. You stick your head on a fire hose nozzle and drink as much water as you can. That's what I feel like right now. I thought it was
You're gonna be okay.
no,
This is
fire hose.
It's kind of like a sinker swim, just throw yourself in a
No,
pool.
no. Learning by fire hose.
there's a visual aid for all of these.
You know, I really
We're going to be okay, everybody. Hey, hey, hey.
Could you figure out if there'd be enough water pressure that